Hi, Kevin Henry, the Group Editorial Director for Advanstar, and I'm on a Google Hangout today with DPR's Technology Evangelist, Dr. John Flucke. How you doing today, John?
I'm doing well, Kevin. How are you?
I'm good, man. Thanks for taking the time to talk to me. We're going to focus today on John's October column that you'll see in Dental Products Report. And, you know, John, I know that you're always kind of looking ahead, which is one of the things I love about you. But for this issue, you actually kind of looked at the things that dentists should be having in their practice now, technology-wise. So what are some of those things that you feel like dentists should be using on a daily basis now?
Well, you know, Kevin, it was an interesting article because when you do things the way I do, like you said, always trying to look forward, what I started thinking about with this particular column was I built a new office. I built it, it's going on 6 years ago. It's been 5 and some change for me. And when I built it, one of the things I tried to do was to plan for the future. You know, how do you plan, you know, the whole infrastructure of a dental office for stuff that you don't even know exists yet? And that was a real challenge for me. And so what I did with this issue was I went back and I said, let's look at some of the stuff that, you know, a few years ago, 10, 15, 20 years ago, people would have thought, well, you know, why would you ever want to use that, or why would you want to do that? And so I looked at some of those things now that we just reach for every day and we don't even think about it. And the first one was computers. You know, when I got into dentistry, you know, there were a few people using computers. It was definitely a minority, and the people that were using them, you know, back in the day, back in the 80s, they were using them just for accounting. And, you know, now you look at what the computer has become to dentistry, it's radically changed how we do everything. I mean, you know, the computer has gone from something that was really kind of handy to have at the front desk and kind of a cool thing to show people and impress your patients with, to quite literally being the center of the operatory. You know, if you look at the operatory as, you know, a wheel, for instance, the computer is the hub, and everything else is just spokes off of that wheel. But if you don't have a computer, none of the digital things that we have today could really exist. And it's, you know, like I said, it's radically changed what we do. I mean, if you have a computer go down the operatory now, you might as well have lost, you know, air pressure in that room for all intents and purposes, because you can't do very much in there from a standpoint of doing dentistry without the computer.
And you're absolutely right. It's amazing how many times I go into practice. You're right, the computer is that wheel. So are you seeing other practices where the computer isn't being used and the dentists are still working in the operatories without that?
You know, I am, and it amazes me. One of the other things that I think is kind of a wild thing for people to be doing now is people will come back and say, for instance, you know, here's one of the other things that I talked about was digital x-ray, for instance. And, you know, digital x-ray has now gotten to the point in dentistry that I think the last DPR survey that we did showed market penetration of about 50%, or maybe a little bit more than that. And of those that don't have digital yet, there was a high number that said, you know, in the next year, in the next 6 months, which I think is awesome, because that's the way the world is going. But what's kind of amazing to me on that is that if you don't have the computer, you can't do digital x-ray, at least with sensors. And so sometimes when I'm out, you know, lecturing or just, you know, hanging out at a dental meeting, I will have people come to me, and generally speaking, they're older dentists. And when I say older, I mean older than me. And they'll say, well, digital x-ray is expensive. You know, that's the reason I haven't done digital x-rays. It's expensive. And, you know, that just blows me away. I'm like, well, why is it so expensive? And so then the answer becomes, well, you know, I've got to have an electrician come in and run all this cabling, you know, this stuff that, you know, makes my computer network, and then I have to buy all those computers. And the thing I always try and kind of coax them back into is, what you're saying really isn't that digital, you know, radiography is expensive. What you're really saying is that digital infrastructure is expensive. And in that regard, I can't really deny that. Digital infrastructure does have some costs associated with that. But you can't make the argument to me that digital X-ray is expensive because the architecture has to be there anyway. Or let's kind of jump to some of the other things that I think you absolutely ought to be using in your practice. I'm going to run through a few of them. You need computers. You need digital X-ray. You need digital cameras in your operatories or access to them to take photos of your patients. You need intraoral cameras, to take photos as you're doing things, to do proper patient education, to show people why that deep, area of decay now needs a root canal because it's gone into the pulp, and you can see on the picture, the blood coming from the area where the pulp was exposed. You need that whole digital infrastructure to put together computerized patient education. So just in that one quick little rundown that I gave you, if you took the cost of the digital infrastructure and you looked at it from a situation of, okay, I need that infrastructure to do computerized patient education. I need that infrastructure to do digital radiography. I need that infrastructure to use digital extraoral cameras. And I also need that to do, intraoral cameras and using, that for patient education. Suddenly, the infrastructure is now, it's not that, like digital X-ray is expensive, because you've now divided that cost into multiple realms of usage. And so, let's just, for fun, let's just say that, I'm a simple guy when it comes to numbers. So let's just say that digital infrastructure costs you $10,000. And people will say, well, that's expensive. But when you break it down into, it's $2,500 on top of the cost of a camera. It's $2,500 on the cost of, an extraoral, digital SLR camera. Suddenly, that price spread across all those devices, it really isn't that expensive at all. But when you try and tag that all onto one thing, like I don't want digital X-ray because it costs me this, that to me, there's a big fallacy in that argument.
No, it makes perfect sense, John. It does. And you're right. I know the price tag is one of the things that really stops a lot of dentists from moving ahead with the technology that they need for their practice. So, well, hey, thanks for the little preview. Be sure to look for John's column in the October issue of Dental Products Report. It'll be arriving in your mailboxes any day now, and be sure to check it out. And John, as always, appreciate the time, man. Thanks so much.
Hey, Kevin, you know what? It's always fun to do this kind of stuff, and I hope that people enjoy kind of getting a little taste of what's going on. Give them an appetizer, so to speak, of what we're going to have in the magazine this week or this month.
Sounds good. Thanks, John.
Thanks.
Take care.
You bet.